again, I think nearly every week, like when I appear on these shows, whenever we have a healthcare story, I just think, why can't you just have a national health service? Like, I mean, Jon Stewart covered it recently on the Daily Show, kind of showing the health ranking of countries and their healthcare systems. And America's, 37 or whatever, and it's just ludicrous. I mean, there was a tweet sent out by John Boehner, it was either yesterday or the day before, saying, why didn't Obama kind of push for an individual mandate for kind of the healthcare system? And I was just like, your party was the one who railed against an individual mandate. Like, how dare you turn it back against Obama now? But that is something that, the next president, well, if that's going to be Hillary or whoever it is, they're not going to push for an individual mandate and try and update Obamacare, at least for the next two or three election cycles.
One thing on that, I think I don't. The individual mandate is already in place. Do you mean like a single payer or a public option? Is that what you meant?
Yeah, public option is what I meant. Yeah, but I mean,
that's
just
really
just
hilarious to see John Boehner talking about a public option. That's facepalm worthy.
He's saying like it was. I think the essence of the tweet was like, oh, if Obama likes government management, why didn't he push for the public option? You know what I'm saying?
Yeah, it's just like, I'm not saying you should copy what we have here in the UK. Like, our NHS system has so many flaws, like they're immeasurable. But if you asked people, like almost everyone in the UK, apart from kind of the really wealthy and the elites, like, would you rather have the NHS or not have the NHS? That people would want to have it because it saves so many lives. You just need to sort yourselves out.
I was listening to a politician from the UK actually on the documentary, Michael Moore's documentary Sicko, which is basically about the American healthcare system. And it was a British politician talking about how that now that they have the healthcare system, they would never go back on it. It would be as backwards as taking away votes for women. The people wouldn't have it. It would make no sense to them to go back on the national healthcare service.
I mean, I think one of the barriers that is stopping America from, developing some sort of national kind of healthcare system, and like, you've got the opportunity because you don't have one at the moment. You can pick the best elements that we have from the UK system, the best bits from the Canadian, best bits from the Norwegian system. You could create, one of the best systems in the world. One of the things that's preventing you from doing that is that there's a fear on the left that they'll be accused of buying votes. It'll be kind of the old kind of, oh, you're giving handouts to the poor people sort of thing. And I think that's one of the things that's scaring people off.
We're already accused of that.
Yeah, but they'll be scared of it even more so.
Well, I mean, there's other legitimate like fears. Is that when a prescription drug is developed, it's usually developed for America because you can make the most money off of it. So we get some benefits from our systems. Obviously, there are some major downsides of it, like everything costs way too much for no reason. But there are some benefits.
You do have some really good, like, specialized. I mean, I know a number of people here in the UK, like, if they get into like those really weird kind of accidents or illnesses and stuff, they will go across to America because you've got the specialist. But it's costing kind of $60,000 or $100,000. So it's fine if you've got the money. That's great, but not everyone has the money, and that's what a lot of the people on the right wing just don't seem to understand.
Yeah, and there's the main idea is that, look, America does have a lot of great things when it comes to their healthcare system, our healthcare system, but guess what? It only works for the people that have the money for it.
But I just want to. The one thing I want to throw in is there was a story a while back that a drug company actually cured hepatitis C, and people were complaining that the cure cost $80,000, right? Which that's a fucking steep price for a cure, but that cure's in America right now. Like, they cured a disease, but it doesn't matter if they did it to make money or not. And like, we may or may not have certain treatments or certain cures in a different system. So I'm just saying there are some trade-offs. Overall, I agree that our system is a piece of crap, but there are some benefits even if costs are ridiculously inflated.
Well, we have a lot of people working on the technology to find cures for things, and we have a lot of pharmaceutical companies coming up with new drugs for things all the time. But you're right. It doesn't do any good if it's not accessible to the majority of the population.
No, I mean it goes back to what like Sean was saying. You've got some really good aspects, but you can create a national healthcare system, taking the best bits from already established systems, with leaving the capability for the great bits that you already have to still exist. So you will have these real kind of specialist areas of medicine and surgery that will still remain. And okay, costs may change. I don't know whether they'd go up or down. They probably might go a bit more up, but it would still be better for the overall nation.
Right.
Well, we're not worried about most of the rest of the nation. As Americans, I think we've really lost our sort of sense of community as far as, what do we do best as a nation? It's more of what do we do best for us.
Right. It's more of a country of I rather than a country of we.
Hey, if you enjoyed this clip, make sure to like and leave a comment below, or even share. Sharing is caring. If you want to see more TYT Nation videos, go to our YouTube channel, youtube.com/TYT Nation. Thank you for watching.